Good morning, everyone. My name is Katrina, and I am the Migrant and Refugee Health Equality Advisor for Women's Health Grampians. And today, with the equality advocates who will be introducing themselves later on, we're going to be chatting about how to break down barriers to equality for multicultural women in the Grampians region. And we know when we talk about equality, it can encompass so many indicators, so many things to talk about. So we're just going to limit our scope to the three social determinants of health, which is access to employment, healthcare, services, and leadership positions. But before we begin, we would like to acknowledge the traditional owners of the land in which I am streaming from. So I'm joining you today from the traditional land of the Wadawurrung people and honor and pay our respects to their elders past and present. I'd like to acknowledge that Aboriginal and Torres Strait Islander peoples have the oldest continuous living culture in the world, and that sovereignty was never ceded. So again, my name is Katrina. My pronouns are she and her. And today in this training, we will be talking about women um, from migrant and refugee backgrounds um, and women in general. So we use an inclusive term or definition of women that includes all people that identify as women and how this specific piece of work can relate and impact them directly, indirectly, and cumulatively. So we'll be talking about a few things. So Women's Health Grampians and our work through the CORE Alliance, the Equality for All project, which I manage, intersectionality and its impacts, particularly to women from migrant and refugee backgrounds, and incorporating lived experience insights from our equality advocates when it comes to accessing employment, healthcare services, and opportunities. And finally, we'll have a little discussion about call to action, and there will be some time for questions in the end. So our work with Women's Health Grampians, we are a health promotion organization funded by the Victorian government to work on gender equality, primary prevention, and increasing access to sexual and reproductive health services. And we cover regional and rural areas across this map and encompass 11 local government units. And our offices are mainly in Horsham and Ballarat. So through the Core Alliance, we're on our 8th year and we have over 120 organizations. And we work on the goals through the vision that all these collective organizations want to create safe, equal, and respectful societies for everyone. So we are working on a collective impact and what we can do within our organizations to break down barriers or at least advance equality, gender equality, and all the other shared goals. So we do have a few offerings through the Core Alliance, but today we will be focusing at the one at the bottom, which is the Equality for All project. We will be sending out resources at the end of this training. So that includes the recording, the different resources that we touch on. So the posters. So don't stress that you're not able to take notes about everything, but we will be sending the resources to you afterwards. So let's begin. So the Equality for All project has been extended for a second round with funding from the Victorian government. And we initially want to raise awareness of diversity and empower local women to be champions of change. So we refer to them as equality advocates, and we're currently working with 9 women from diverse backgrounds, and they represent women in the Grampians region across age, ability, gender, race, sexual orientation, culture, ethnicity, religion, or faith, language just spoken language just spoken at home, marital status, residence status, and all other social locations. So, this presentation in particular was developed through a co design process with 5 equality advocates from migrant backgrounds. And we recognize that we're at the beginning of Refugee Week and we don't have women from refugee or asylum seeking backgrounds in the project. And that's something we will consider for future tranches of the project and how we can break down barriers to participation and engagement within our own project. So we thought we would shake things up a bit and incorporate lived experience insights as we go through the presentation and have organic conversations about the topics we're covering today. Um, and I'd love to present or to let you know that we're joined by sorry, can't count. We're joined by 3 equality advocates today, and I will ask them to introduce themselves using the terms they resonate with. So, would you like to start, ladies?
Hi, everyone. My name is Brenda Nakanjako. I come from Uganda, East Africa. I am a lawyer by profession. I am currently completing my Master's of Social Work degree with Federation University, and I'm currently on placement with Ballarat Kaza. I'm a mother, I'm a wife. I am in Australia on student visa currently, and I am an equality advocate.
Lina or Madupe?
Okay, I can go next. Hi, my name is Lena. I moved to Australia in 2016 after my marriage with partner visa. So fortunately, with partner visa, I'm eligible for Medicare and those eligibilities. I was born in India. I grew up in Singapore and worked as a software engineer for many years. I worked in tech industry and then government sector, and currently now I'm pursuing Bachelor of Community and Human Service in Federation University, and also I'm currently working part-time in Women Health Grampians. Intersectionality affects me because of my gender, age, marital status, ethnicity, and residency. Taking part in Equality for All allows me to educate and inform people about how prejudice and unconscious bias affect others. Also, it lets me contribute to the discussion and support efforts to address discrimination and inequality. Thank you. Next, Modipe.
Good morning, everybody. My name is Multicultural Oyekami. I'm Nigerian. I moved to Australia in 2017 to join my husband in Australia. I'm a wife and mom of 2 lovely girls. My background is pharmacy. I studied pharmacy in Nigeria. Moving to Australia, I had to change my career pathway. So currently, I own my business working as a finance broker, and I've been doing that for the past 4 years. Equality for all speaks to me a lot because I've experienced a lot of discrimination in some certain areas as a woman of color and being from a diverse background. And the reason why I've joined this initiative is to educate people and to also empower other women around me. Thank you.
Thank you, Brenda, Lina, and Madupe. We will have other questions throughout the presentation, so I'm really excited to hear more from you ladies. So now touching on for the Equality for All project, again, we're basically here to strengthen the core alliance, which is the communities of respect and equality that Women's Health Grampians is the forefront of. And we do this in 3 simple steps. So number 1, we amplify authentic voices of the equality advocates who we consider experts with different platforms to share their lived experiences. So it could be at events, meetings, webinars like this one, trainings and workshop, whether face to face or online. And second, with core members like yourself or core friends who have the open mind and willingness to listen, you can hear their stories and gain a deeper understanding of how women from diverse backgrounds experience compounding discrimination and gender inequality, whether it's intended or unintended. And third, through that process, you can think of, reflect, and apply feasible and effective actions or strategies that will be included in your core plans or core action plans, which are tailor fit for the specific needs of your organization when it comes to employee retention, attraction, and overall connectedness with your organization. So we've touched on intersectionality, but what does it really mean? So essentially, it's the notion or the knowledge that women, men, and gender diverse people face multiple forms of discrimination. And an American law professor in 1989 coined the term intersectionality. Her name is Kimberly Crenshaw, as the complex and cumulative manner in which the effects of different forms of discrimination combine, intersect, and overlap. Essentially, intersectionality is everywhere because women are not the same. There are differences and inequalities between women. Put simply, when we talk about privilege as having an advantage, women from diverse backgrounds kind of fall within the cracks, and we need to think about how to make things better for people that are usually unheard from or invisible in policies and structures in the way they were designed. So, how does that look like? So, here, for women from diverse backgrounds, we essentially, when we experience compounding discrimination, it can come out as sexism, racism, colorism, and when we're at over the age of 55 or 60, we can experience ageism. And they're all, so we don't operate in silos. There are women from migrant or refugee backgrounds who also have disabilities, so they can experience ableism. So it's just knowing that intersectionality is not about, it's a necessary part of our work because it allows us to reflect about power dynamics that perpetuate systemic discrimination, and it considers bias and barriers as they impact us depending on our different identities or different characteristics. So we acknowledge that different groups of women will be affected and disadvantaged by programs and policies in different ways. And we are focusing on women from migrant and refugee backgrounds because we know that all women face multiple forms of discrimination. But here in this context, we'll talk about our research and lived experiences as women in this space from migrant and refugee backgrounds. Um, so we can talk about identifying terms. We've looked at research and some studies, even some articles. And when we talk about women from migrant and refugee backgrounds, there are several terms out there. So for the longest time, we've had CALD, which is culturally and linguistically diverse. Now, more recently, there is the word CARM, which is culturally and racially marginalized, which kind of talks about the real experience as someone from a non-white background or non-Anglo Celtic group. We also talk about born overseas and then English as a second language. And in some of our cases, it could be the third or fourth language. With settlement services, I like the term that they use. They say new arrivals. but the more accepted term would be multicultural. But I think it's important for us to understand that language, as well as inclusivity, evolves. And it's best to ask the individual how they would like to be addressed or identified, which is why we let the equality advocates introduce themselves. So here we talk about the impacts of intersectionality and how racism, gender inequality, sexism, name bias, accent bias in most cases, these are systems and these are the cause of the systems, structures, and institutions that facilitate these multiple forms of discrimination, and how the attitudes of behaviors and norms in society reinforce this. Um, we often other different cultures when, or in fact, everybody has their own culture. Um, so it's important to focus on the real drivers of violence and discrimination, apart from blaming it on the cultures of people who have decided to make Australia their home. And how the media reports on news stories and incidents reinforce these violent stereotypes. So what do you mean by this? How does this look at in terms of how does this look like in the context of women from migrant and refugee backgrounds, and what do we see on the ground? So it's just saying how compared to Australian women and women from first Australian and First Nations women, we are sorry, I lost my train of thought. No, so compared to the wider population, and although we recognize that there is a lack of local data pertaining to the Grampians region, we do see that when we look at whole of population, women from migrant and refugee backgrounds, 1 in 3 have experienced family violence instead of 1 in 6 when comparing to the whole of population. And there is a lot more risk or higher risk for um, intimate partner violence or family violence when it comes to their visa status. Um, and there's a whole other things that we found in different research, which is concerning when we consider that when you look at the population of Australia, approximately, this was from the 2021 and 2022 statistics. Approximately 30% of the population is born overseas, and how 50% of the whole population either has a parent born overseas or is born overseas. Um, and when you look at the multicultural makeup of Australia itself, there seems to be a disconnect, and there's a lot of gaps because our systems and organizations aren't so safe for multicultural people. And with the Core Alliance, we see the commitment to making a difference in this space. And I think it's important because Australia benefits from migration, um, and how our policies of migration or immigration reflects the needs on the ground when it comes to economic development, employment, and demographic diversity. Um, the equality advocates here, as an example, they fill gaps in the system with their expertise, their knowledge, and their qualifications. Yet, it's so difficult to find gainful employment, which leads us to the 3 social determinants of health that we will be talking about today, um, and why these need to be prioritized. So we'll just skip that one. So when it comes to structural barriers, we have found that there are actually 4 themes. There's time, cost, access, and safety. And some of them, depending on the context, they intertwine and either have a causal or correlational relationships. Perhaps there's a better way to illustrate this one, but for today, this will have to do. So let's move on to the first social determinant of health, which is gainful employment. And in this section, we'll reference two reports. Um, so even the Department of Home Affairs is aware that CARM women, so women from diverse, multicultural backgrounds, have poorer labor market or economic participation because of the structural barriers leading to fewer employment opportunities, making them face three options: underskilling, underemployment, or unemployment, making them at a risk higher risks for homelessness, poverty, and labor participation. So they do see the gaps in the system, um, and acknowledge that everyone, despite their backgrounds, their gender, their age, need to have the opportunity to reach their economic potential, because that is key to having better health and well-being outcomes. And in the case of migrant and women from migrant and refugee backgrounds, we need that for better settlement outcomes and integration into Australian society. So we have seen the different examples of these barriers, but now I'm going to pass on the microphone to the equality advocates because I'd like to hear from their own insights and experience. So, Modupe, Brenda, Lena, what were the barriers you faced when applying for a job or seeking gainful employment?
Personally, when I moved to Australia in 2022 in July, because I was starting my studies then. Coming here, like I said, I am a lawyer. However, I did get my qualification from back home in Uganda, from Makerere University School of Law. That university ranks among the first top 20 in Africa. So it's a pretty good university. But coming here, I struggled with landing my first job because the cost implication for preparing myself to be job ready was quite heavy.
Sorry, Brenda, can you speak louder into the microphone?
Sorry, it went up.
There,
Is that better? All right.
Yes.
Sorry. So the cost implication for being job ready was quite high because I mean, I had so many checks to pay for and complete before I could even be considered. And when I finally got all that done, it came down to my Australian experience, which I didn't have any. I mean, I was just moving from Africa to Australia. So all the previous experience that I had didn't quite matter. So I had a number of jobs that rejected me because I did not have an Australian experience. And then my immigration status, being on student visa, well, currently now we even have a work limit of 48 hours per fortnight if the semester is on. But when I came in 2022, the government had lifted that limitation, so I could work as many hours as I wanted. But being on student visa, there are jobs that specifically I could look at their requirements and I knew I could do them. I even had the qualification. I mean, because I had, on top of my law degree, I had other qualifications as well. But I could not apply because these jobs outright said or required that you're an Australian citizen or of permanent residence to apply for them. And then when it came down to referees, I mean, of course, coming from home, the referees that I had were back home in Uganda. So it was hard. It was really hard. I had a number of rejections because people probably didn't want to take the time to look out. And I'll take this opportunity to actually thank organizations like Vic Roads, because my very first job in Australia, I was Vic Roads. I worked at the Vic Roads call center, and they did actually reach out to my references back home and considered me for the job, regardless of my experience or my referees. So that was really good. So yeah, those are some of the challenges that I faced. I could go on and on, but I know by the time Lina and Madupe wrap it up, they'll have covered some of mine as well.
My background is in pharmacy, and similar to Brenda, when I located to Australia in 2017, cost and access were mostly the constraints for me to upskilling to practice pharmacy here in Australia. The expenses associated with upskilling for my pharmacy degree to practice in Australia included fees to write the exams, and the exams included phases. So if you don't pass the first phase, you can't go to the next phase, and you would have to rewrite it again, and it cost thousands of dollars. The certification process was so challenging and very difficult to manage. Another challenge I faced was the access to the required resources. And there wasn't just sufficient programs that I could do, a short program that would allow me to practice pharmacy. So even though I had the experience in Nigeria and I had the certificates, I couldn't even work as a pharmacy assistant here in Australia. I wasn't allowed to. And I needed a experience to fit into the Australia employment system. So those were the challenges that were so difficult. And that's really similar to what Brenda just mentioned as well.
Hi, this is Lena again. So the barriers I faced was definitely all of them: time, cost, access, and safety. As you know, after getting married, I got my partner visa with full working rights. But having the partner visa as my visa has kind of discriminated me because that shows my marital status. I'm married. So when I was applying for a job, I remember clearly there was one experience where I was asked to come to Melbourne for an interview, and I have to travel almost 2.5 hours to Melbourne for an interview. It was like, I was a software engineer back in Singapore, and this is like administration kind of role. And when I went to the interview, I was asked, the first question I was asked was, he asked about my past experience, and he immediately asked, because I have a partner visa, whether I have any plans to have kids anytime soon. I was a bit taken aback. And also, he also started inquiring about, he kind of got curious about my husband, who he is, and how we met and all the stuff. And then I don't know, I was very new, so I was a bit taken aback. And then he started, and it happened to be my husband works in the same sector as their organization. So he started interviewing my husband through me. And yeah, so it was a bit shocking to me. And he started asking about my husband's salary and like how much he's earning and all the stuff. And I refused to disclose this information. And finally, he said, you know what, I think you're too highly qualified for this position. He already made up his mind before he even interviewed, what's the reason why he called me for an interview when he already knows my qualification. And then he tells me that I'm too highly qualified for this role, and I also have I don't have an Aussie accent, so clients prefer Aussie accent. So I was felt a bit taken aback, very frustrated, like my whole day is gone just to travel up there just to hear this information. And he also said straight up that since you're highly qualified, you will not stay in this organization for long. And I said, that's not the case, because I'm planning to, I have transferable skills, and I'm planning to change my career, because I don't think I want to be a software engineer forever. People do change their careers in the career path. But yeah, that was a bit shocking. And also I faced that, apart from the job, I also faced I even started looking for jobs in Bharat. It was very hard to get a job in Bharat. Even the lower jobs, they were asking for certification, and we do have like better skills, transferable skills, but they don't recognize that. So they want certification for each and everything. Whereas back in Singapore, people hire you and they easily train you up because you already have some skills to transfer. So that was my experience. And yeah.
Katrina?
Yes.
Could I just add something?
Yes, certainly.
I'm currently completing, like I mentioned, I'm currently completing my master's degree in social work. You'd think that my previous experience that I've given, because I was new and had no experience here, that having lived and worked here for 2 years and studied here, that would be enough. But no, as I finish my social work degree, I must redo the IELTS test again, which costs $450 per sitting. After doing that, I have to pay another $350 to accredit my qualification. It is a must for me as an international, as a foreigner, to be able to practice here in Australia. That's not the requirement for Australians.
Yeah.
So I can't even work, even after studying here and working here, getting the experience. We still have to keep jumping through hoops to match up.
Thank you so much for sharing, ladies. And yes, it is quite difficult to break into, or I think get your foot in the door when it comes to employment. But by raising awareness of the lived experience you've had, I think we've all had, because a lot of the things that you shared have resonated with me as well. We can make a little bit of a difference, at least within the core alliance. And we talk about the importance of gaining access to employment, but it's also important that we remain safe in the workplace. So there's a few different studies that talk about women from migrant and refugee backgrounds' experience in the workplace in Australia, and they're not always positive. So to segue perfectly from that, what can core organizations do? And in this section, we just to let you know that this poster has been co-designed by the equality advocates themselves, and it reflects experiences and the feelings of ourselves and our own communities when it comes to accessing gainful employment. And we've thought about what we would like to touch on or explain more of. So I'm gonna give the speaking or the microphone back to Brenda, who's going to start for us. So here the question is, out of the 5 key messages, which call to action would you like employers to prioritize, or which one resonates with you the most?
Recognizing transferable skills.
Mm-hmm.
Of all the jobs that I've spoken about when I just moved into Australia, the ones that I got so much rejection for, even for me to be, that was working in the disability sector as a support worker. My breakthrough in that industry or in that area of work was from an opportunity given to me by a fellow immigrant who now runs his own organization or runs his own business as a disability support worker. So that's how I got the experience that now, appeared and helped me build all this. But in saying that, why I chose recognizing transferable skills, it's because in the disability sector, for instance, the skills that are needed to work in that sort of work are taught to us. Where I come from in Africa, culturally, from my upbringing as a woman, I am taught to provide care from when I am a little girl. That's what our culture teaches. Everything that we do in disability, we do back home. We've been raised to provide that care. And I had personal experience, which I did put on my CV. My mother suffered 2 strokes 8 years ago. I was her primary caregiver. Not looking at, say, the stroke patients here in Australia, there is no difference. It's the same. The same care that they need is the same care I had to give my mother. I would even say it's harder back home in Africa because you don't even have, say, for instance, like the personal care. You can't afford to buy boxes of gloves every time. So if it's your mother, oftentimes, I mean, you do it freely if you can afford the gloves well and good. The changing, the manual handling. We don't have the luxury of hoists like we do here or two persons assist. If you're the one taking care of this person, that's your responsibility. The manual handling is actual manual handling. So for me, it was just appalling that even with all that experience, even with all those skills, still I was still being rejected because I did not have Australian experience, because I did not have the qualification. Which qualification is a certificate for in disability. You're talking to someone who has a degree already. Like really, you'd think one being higher than the other, there are skills that surely are taught and can be transferred from this to that. And they keep telling us in these jobs they offer on-the-job training. But when it comes to immigrants trying to find their way into such employment, then they bring on all that. Oh, you lack the experience, you lack the qualification. I did finally go on and got my qualification as well. And it still didn't add anything different from what I knew. It's just me bagging the experience, sorry, the qualification and knowing, okay, now I also have the qualification. So yeah, for me, recognizing transferable skills definitely is the top one for me.
Thank you, Brenda, for sharing that with us. Lena?
Yeah, I believe for me is make cultural humility training part of ongoing professional development to recognize unconscious bias. I think it helps to raise awareness of the biasness, and it helps us, for the decision makers to make decisions based on facts rather than, your own preconceived notions. And also it reduces the risk of discriminative practice. Another thing is the employees are better equipped to make fair and equitable decisions, whether in hiring, promotions, team assignments, or client interactions. So yeah, it fosters an inclusive environment where everyone feels valued.
Thank you, Lena.
For me, all of these points are very, very important. But what I would really like to stress on is for companies or organizations to ensure recruitment policies and practices are inclusive, welcoming, and accessible. You won't imagine here in 2024, candidates are still not getting calls because of their names. Say, for example, someone applies for a job, the person has a really long name like Mojupeola. The employer sees the name and is like, nope, I'm putting this in the bin, not qualified for the job because of the name. People have had to change their names to English names just so they can get an opportunity to be interviewed. So organizations with a diverse workforce can really benefit from immersive, unique perspectives, global skills from people from diverse backgrounds. And as someone with a background in pharmacy, I've experienced that I've actually missed out on that in the sense that when I relocated to Australia, I wasn't able to get a job because of my background, because of my name most times. So it would be great if organizations can incorporate very flexible recruitment policies and they're very inclusive to people from diverse backgrounds.
Thank you so much, Madupe. And that's a good segue on our next topic, which is the second social determinant of health. And that's breaking down structural barriers to accessing healthcare services. And we have the same four categories here: time, cost, access, and safety. Um, so I'm gonna put that back onto you, ladies. What were the barriers you faced when accessing a healthcare service?
For me, the two that stood out for me in my experience were time and cost. So for all my jobs, well, I have managed to break through the barriers, and I have like 3 or 4 jobs when I can make the time to work. But for all those jobs, I'm a casual employee. So finding the time between, so as a social work student, I have to complete 1,000 hours of placement. So I had an experience where I got an ear infection, and I was on placement. It was during my first placement. So I was on placement 4 days a week. When I'm not on placement, I was working. When I was not working, I was in class or completing an assignment. I barely had time to literally do anything else other than those 3 things. So I failed to find the time to even fit in an appointment because it was clashing with, because for me to even take time off to go and complete the appointment meant interfering with all these other things. And I was working on a timely schedule. And the cost. So for that ear appointment, I remember calling in and asking how much it would cost me, because of course, being on student visa, I do not have Centrelink, and my health cover doesn't cover it. It's very basic. So I called and inquired how much it would cost me, and the lady I spoke to over the phone told me between $200 and $400, depending on what your consultation will be. I remember telling myself, I'm going to pray over this, and God's going to just have to make a way to take this ear infection away. Luckily for me, I figured out what was bringing it on. So I stopped it, and the infection stopped coming on because it was recurring. It would come on and then stop, go away for a few weeks, and then come back. And then I finally figured out what was bringing it on. So I stopped whatever it was, and yeah, the infection went away. So somehow I got divine intervention. But practically, I couldn't go in to see a doctor because I didn't have the time or the money for it.
Thank you, Brenda.
Yeah, next is me. So for me, is the time, access, and safety. So my experience with the healthcare was when I had a baby. For a regular checkup, I had to go to see the GP, and I was not able to travel especially in Balrat, because the transportation, as you know, is not convenient. It takes about 1 hour sometimes when you have to change the bus. So me and my husband, we used to share the car. So my husband used to come from workplace to pick me up to take to see the GP, because there was no direct transportation, no direct bus to the hospital. And I also faced, so it became like time and cost assess because of the transportation, and also the safety wise. When I saw this GP, she gives. I was not working at the time, so she gave more importance to my husband. It's not in my head, because I asked a question regarding my baby, and she will be looking at my husband answering those questions. I felt a bit insulted, like as if I'm not smart enough because I was not working. And there was sometimes she subtly informed, like, maybe you should be independent. Like why your husband is dropping you off, like I'm wasting my time. It is actually a mutual decision between me and my husband. Like financially, it's more practical for us when I'm not working to share one car. So I felt pretty bad. She put him in a pedestal and me, at the bottom, because so it felt very uncomfortable. And also there was one time I had, she told me to do some cervical screening. and I was not comfortable as just 1 month after the delivery, and I still had that that I had a minor surgery there, and I felt uncomfortable, and she was very insisting that I should do it on the very day, when she didn't give me any choice or information what is the procedure, like how to do and all the stuff. I have no idea, I never done it before. So yeah, and when she kind of pushed me into do it on the day, but I resisted. But in the end, she told in front of my husband that I have low threshold of pain because I refused to do cervical screening on the day when she told me. I felt very hurt because I know the pain in me, because I can feel the pain in me. So I went to the actual hospital. They delivered my baby, and I kind of doubted my own pain because the GP, just just push it away, that disregarded my pain. So I went to the hospital, and when I checked with them for regarding this pain, they did acknowledge I had. This is not, like, this operation does cause pain. It's normal for the pain. They acknowledged my pain, and they made me feel valued. So in the end, I went to the hospital to do the cervical screening, not to the GP, because I didn't feel safe in her presence. And in the end, I told my husband, I don't want to continue with this GP. I have to find another doctor. She's a knowledgeable GP, but she didn't feel me safe, and she was very judgmental about me not working. We sharing the car, so I didn't feel very uncomfortable with her.
Thank you for sharing, Lena. Now, Madupe.
Yeah, for me, look, I haven't really had a particular challenge in accessing healthcare. However, what I've experienced with others, people from diverse background, facing is complexity with navigating the medical jargons, and also the racial stereotypes. Say, for example, I've had a colleague of mine that's told me, oh, I went to this doctor and I was told, you don't feel pain. As a black person doesn't feel pain. You shouldn't feel pain. You have a really tough threshold for pain. You shouldn't feel pain. I've also had someone who is having a baby, and they were told, no, you can't get that medication because you have to just give birth. You have to just have the baby. You can't feel pain. You don't feel pain, so you don't know what you're talking about. It's like you're in the person's ear or you're in the person's head. So those are just the challenges I've heard. There are a lot of challenges, honestly, but from my perspective, that's what I've heard people experience people talk about.
Thank you for sharing that one, Madupe. And I think we've touched on a lot about, well, just we've touched on um, the notion of blaming it on language barriers when really a lot of women from migrant and refugee backgrounds in the Grampians region are actually well educated, and they've had to move rurally or regionally for higher education or for um, employment opportunities. And it's really just that medical jargon um, and the accent bias that are posing more barriers to us. But I think I'd like to speak on something that was done right. When I was accessing a healthcare service, the reason why I stuck to my GP, who's still my GP today, ongoing 4 years, is because every time I visit her, she knows my name. And I know it's so simple, but we're often misidentified with a different name. So hearing someone say, "Hey, Katrina, how are you today? Um, how's this so and so?" Like referencing to our last meeting, instead of asking me like, "What took you so long to get here?" And after hearing from the equality advocates, like there are so many nuances to experiences of why we don't have the privilege of time and perhaps money to just show up and book the soonest possible appointment, because the soonest possible appointment could be 6 months away, depending on the specialist that you need. And that kind of brings us to this phenomenon, which is the decline of healthy migrant effect, which talks on, I'll just touch on this quickly, where they say that during your settlement years, which is up to 5 years or up to 10 years in some cases, your health declines significantly. And that could be a causal or a correlational effect because our choices when accessing healthcare are very limited or become like we basically have no choice but either to wait or to just go access a healthcare services when things get really bad. Um, and they're saying how they know this because when women from other countries or who are born overseas enter Australia, we don't just have to prove English proficiency. We have to prove that we will not be a burden to the healthcare system here. So we undergo rigorous medical testing that cost a lot of money just to be approved or to be considered to be approved for whichever visa we're applying for. So they do have that baseline that, this is your healthcare or this is your health outcome or these are your numbers when you entered Australia. And then when you come back 5 years later or up to 10 years, you see that significantly decline. So, in saying that, what can health professionals do? And we've done the same thing where I've asked the equality advocate to choose which key action they resonated with. So, can we start with Brenda?
Explain medical jargon and relevant information in a way we can understand. Personally, there is something that I have not understood. I have to this day I do not understand, but it affects my medical experience here. So on my student visa, I must have student health cover, which I do have with Bupa, and it's supposed to apparently cover if I go to a place that bulk bills. It's supposed to cover my I pay up front first of all, but I can claim the full amount from Bupa if I go to a place that bulk bills. If you don't go to a place that does bulk billing, then they pay you just half. They give you back half of what you've paid for a GP consultation. I have every time I try to ask about bulk billing is everyone I've asked gives me this impression of you should know, like they're like, oh, just bulk billing. I'm like, can you explain it? Like it doesn't make sense because I would imagine it doesn't matter whether they're bulk billing or not. I've seen a GP, it's the same cost, just give it back. So and so many times like I've had friends who are like, oh, I went to this clinic or something and this hospital and they explained something but I didn't quite understand it. And I'm like, and then why didn't you like ask? And they're like, oh well, the lady said it and assumed that, I should know what it means. So for me, explaining medical jargon and relevant information in a way that we can understand would be really helpful.
Thank you, Brenda. Now, can we hear from Lena?
For me, as I shared my experience earlier, I strongly resonate with facilitated non-judgmental environment and believers. So yeah, our concerns are valid and should not be dismissed. Just like when I told her, when she wanted me to do the cervical screening, I said I'm not ready for the cervical screening because I just had, my body is still in pain after 1 month of giving birth. So she just disregarded me. So I think you should, they should listen to the people and not be judgmental, even with your clients. You never know what your clients go through. So listen to them.
Thank you, Lena.
Yeah, for me, the call to action that resonates with me the most is enable us to make informed decisions. So if the medical jargons are being broken down to layman terms, we would be empowered when we are active partners in our healthcare journey. And having access to this clear, comprehensive information would also lead to better outcomes in our healthcare journey as well.
Thank you, Modupe. And now that I look back to this poster and our co-design sessions, it kind of resonates more because I thought like, oh, wouldn't this be, I suppose because we live with our own experiences 24/7, there is this like notion that shouldn't these messages and key actions be common sense. But I do realize that we do bring in that multicultural lens to the table, and not everyone has the same experiences as us. So it's a good reminder that these do, although they look simple, they are key and feasible actions that can be done by healthcare professionals. So I'm very proud of the messages that we created. So now, moving on to our last topic, it's a third social determinant of health, which is accessing leadership opportunities. And what we found is like having leaders who look like us or at least represent our own like priorities really makes a difference when we see when it comes to decision making programs and policies that are in place. So we can move on to hearing from the equality advocates about the structural barriers to accessing leadership positions. And I think I have this question um, that I asked them. So it was like, what are your thoughts on current leaders that you see in Ballarat or the Grampians region? And what is your experience on leadership? So maybe we can start with Brenda again on this one.
Sorry, Katrina. So which one am I answering?
Whichever you want.
Well, for me, I find that the structural barriers to accessing leadership opportunities for us as women from migrant background relate more to cost because upskilling like is really expensive. Like I told you, for instance, I myself I had to pay another $1,450 to do my SAT4 in disability, whereas I was paying about close to $10,000 that same semester for my other tuition fees. So there is no way I'm going to climb up in the ladder of my job if I am not skilled enough. And for me to get that skilling, I must pay. Whereas for an Australian, for the same cost that I pay, say $1,450, they do it free of charge. Because for that, in that college where I did it, for Australians, they were doing it free of charge. In my other job, I recently completed my upskilling in my residential care work, and I paid about $3,400 for a course unit. Sorry, for that those upskilling units where an Australian paid I think $50 because they're free of charge. So, and yet these are limitations. If you do not have these qualifications, you stay at the baseline. But it's not because you cannot do the work, it's because you don't have the necessary skills uh, as per the qualification requirements. So yeah, for me that's the biggest challenge.
Thank you, Brenda. Now let's hear from Lena.
I don't have a personal experience regarding the leadership opportunities, but I can definitely see time and cost does make a huge impact for migrant people. I would like to see more people, multicultural people in leadership positions, because it ensures that we have diverse voices within the community and we are represented and empowered. And also leaders from different cultural backgrounds bring unique perspectives, insights and priorities to decision-making process, which can better reflect and address the needs of entire population in the town. And also is essential for fostering a place where all residents feel valued, heard, and included.
Thank you, Lena. Now Madupe.
Yeah, while the current leaders here in the Ballarat and the Grampians region, they've made significant contributions to the community development. However, I believe there is a notable lack of diversity amongst the leaders here in Ballarat. The diverse leadership is crucial for bringing various perspectives, experience, and ideas which can lead to more innovations and equitable policies. And the leaders they all come in different forms, like different shape, different colors, and we need this in the Ballard region. I'll give an example about what happened to me when I moved to Ballarat in 2021. As a business owner in the Ballarat region, I joined a women in business group. And every time I attended this group, I just felt out of place. I felt everyone was so cliquey. I was the only person of color in the group. And there are multiple business owners that are people of color here in Ballarat. But I just felt I didn't have a voice. I had to impress everybody in order to fit in. So in 2023, I just thought, instead of me just trying to fit into this box, why don't I just stand out on my own? And I created a group which is called Empower Her Diversity Collective, which is a group of women coming together to encourage each other and to also lean in. So I hope in the Ballarat and Grampians region, I hope we would see various forms of leadership and various color in our leadership.
Thank you, Madupe. And I think that touches on the existing study that came out recently from the Diversity Council of Australia, where they say CARM women, or women from migrant and refugee backgrounds, do tend to be locked out of leadership because of several indicators. So there's fewer career opportunities because of the barriers that you've mentioned through sharing your lived experiences. We tend to be subjected to a higher bar, and we're underestimated, overlooked, and undergo other discrimination like racism and sexism. And you seem isolated, especially if no one else looks or sounds like you. It kind of resonates with a lot of, even if this study, what do you call that? Their catchment, or the women, 377 women they interviewed for this study. They're mostly based in Melbourne. I see that resonating in regional and rural areas more profoundly, because of in more metro areas, you can see that 50% multiculturalism reflected, whereas in Ballarat, as an example, there's only 11% of its population born overseas. So you can see that discrepancy, like, as a multicultural town, as a welcoming city, that we do claim, and on paper we look great, but why are women from the multicultural backgrounds not moving, or families from multicultural background not moving to Ballarat as a preference, as a city to live in? And it touches on the barriers that we're talking about today. Enough of that. Yeah, so here's just an infographic of what we've seen, that there seems to be like a barrier, whether it's a concrete ceiling, a glass ceiling, or a broken rung in the ladder. If we're, as organizations or as leaders, if we're not consciously trying to break down those barriers and asking ourselves the important question, who is not in this room? And then follow it up with, how can we make a difference, or how can we change that? Um, then it's only that time that we can actually um, change what we view as business as usual and challenge the status quo, if that makes sense. So, equality advocates, I'd like your help with this one again. Out of the 5 key actions, which one resonates with you the most?
I think for me, it's avoid doubting our competence. We are very capable. We are very learned. We have skills. We have contributions that we can make. We disregard our color, our accents, and look at what what we also bring to the table. We're just like any other, you know, white people or white Australians. So when it comes to the professional, sorry, to the professional setting, we should just be given equal consideration and not doubt what we can or cannot do.
Thank you, Brenda. Let's move on to Lena.
I would choose avoid doubting our competence, because the organization should actively acknowledge and appreciate the unique skills and perspectives gained through overseas experience, and also foster an environment where employees feel comfortable discussing their international experience and the skills they have developed through their years. Thank you.
All of these points are very, very important. But one I would like to really talk about is create mentorship programs and leadership pathways to facilitate career progression. I know one would say there are a lot of mentorship programs here in the Grampians region. Yes, I'm aware of that. There are a lot of mentorship programs, and I've participated in one of them. And it was not, I didn't, it wasn't a good, mentoring session for me. So my mentor during the mentoring session told me that unfortunately, no one here in Ballarat is going to do business with you because you're a person of color. That day he was talking to me, I felt the ground would just open up and swallow me. That was just my feeling that day. And when I got back home, I just kept on thinking to myself, am I in the right place? Am I doing the right thing? This is a mentorship program that I have to go through, right? It's a business mentorship program. And you're there sitting there and telling me that I'm not capable, I can't do it. So I really encourage our organization to create great, diverse mentorship programs. I want to attend a mentorship program. I'm not being biased here, but I would like to speak with a woman that understands what it's like to be a mother, that will understand what it's like to be a business owner, and would also understand what it's like to be a wife. I would like to talk to someone that is like me, because the person can relate to me. I can discuss my challenges with the person, and the person would say, yes, I understand you. And the person wouldn't say, oh, you're just saying nonsense, or you're not in the right career, or you're not in the right business. So it'd be amazing if I can see my color talking to me. And also, it would be great if we can get more feedbacks in the mentorship program. It wouldn't just be fair if the government is pumping out money to mentorship program and I'm attending the mentorship program and I'm not getting positive feedback. So just that's one thing I would like to see more of. If we can get great mentorship program, having my person, like someone that looks like me to mentor me, and we can always get that. We can get that here in the Grampians region. We can get that anywhere we want to. So that's just what I would like to emphasize on, and I really hope it's been worked on.
Thank you, Madupe. That's very interesting insights from the equality advocates also. And one thing that I keep talking to my managers at Women's Health Grampians, I don't see enough leaders who look like me, who sound like me. I suppose it doesn't really matter, but how can I guarantee that my voice is represented or my priorities are represented in the way that they make decisions? And then came to a point where it's like I might end up having to wait for a long time for that leader. Um, and then forced myself to you know what, step into the light and be that leader for someone else. And I think we have to be at the forefront of this in the meantime while we recruit more leaders or more leaders emerge from these spaces to do the work that we do. So that's towards the end of our presentation, and we just wanted to iterate these key messages that listening to lived experiences is important for creating change, and applying intersectionality should not be an add-on. And if we really want to create a safe, equal, and respectful society for everyone, regardless of where you live, we have to help break down structural barriers to equality, especially for women from migrant and refugee backgrounds as well, whose voices tend to be unheard. They tend to be unseen in rooms filled with decision makers, and just get left behind unintentionally. Um, and then we also need to be recognized as residents who add value and be allowed to choose the words that resonate with us. And yes, now we'll move on to questions. Thank you for sticking with us up to this point. Does anyone have a burning question that they would love to ask our equality advocates? No? Yes, you can turn your mic on or put your question on the chat, and we'd be happy to answer your questions. Very good question, Mel. So, for the equality advocates, do you think things are changing now? Slowly?
Honestly, for me, I think things are changing, yes, but for worse, because being in my current situation as a student that's on a student visa that's almost completing and looking ahead to apply for my next visa, look at all that visa changes that are coming. They are making it harder for us to stay here. So we do come, work through thick and thin to get the qualification to try and live up to the expectations that are needed of us. So we have the experience, now we have the qualification, and then they're making it hard for us to stay. And it's like blaming everything that's going wrong in this country currently on us. The rise in cost, the rise in housing, that everything right now when they're looking, the biggest problem that seems to be happening is the number of immigrants that are here on student visa, and they're trying to keep us out or get us out, as many of us as they can. So yeah, there is change right now, honestly, for us, but we'll keep being hopeful, and that's why we're doing this, hoping that those of you that are listening in, sitting in these organizations, do understand the plight that we're faced with and can make better decisions in your different roles to make it better for the people of different different diverse backgrounds that you come across.
Thank you, Brenda. Modupe.
Yeah, I would say things are slowly changing, which is positive. Joining organizations like the Women Health in Grampians and attending the sessions, empowering people and educating people, there's been a shift. For example, here in Ballarat, I have a medical doctor who is Nigerian. So that's my GP. That's the person I see. She understands me very well. She doesn't tell me off. She explains and breaks everything down to me. And in terms of the leadership, when I started Empower Her Collective Diversity, I approached leadership in Ballarat. They were supportive because they were not aware this was happening. They just thought everything was fine. But when they saw someone speak to them to let them know this is what's happening and educating them, they were aware, and things are slowly changing, which is positive.
Thanks, Modupe. I just unmuted myself. I think that's a very good question, Mel. I think they are slowly changing. slowly for the better. And in some organizations, it's quick because leadership is supportive, or it's a strategic priority for specific organizations, to make sure that diversity and inclusion is embedded in everything that we do. And I think it's that recognition that Ballarat's population is growing exponentially, or even the Grampians region. More more people are moving regionally and rurally. So it's important to have representation in businesses, in services, to reflect the clientele base that they're aiming to attract. Um, so I think it's slowly getting there. And I think through the Core Alliance, I have rose-colored glasses on because I can see the commitment of specific organizations who really do engage with us through the Equality for All project and talk about specific things that they want to change and their commitment. Um, but you followed up with another great question, and I'll address this to the equality advocates. How would you recommend an Anglo-Australian better welcome a new Australian? I love that. A new Australian or a new arrival, besides what you've already touched on. Ladies,
I think one of the things is like new Australian as in like they become a citizen. Is that what you mean?
or like
Yeah.
at least a new resident, because not everyone wants to be a citizen.
I think get to know their culture and not to have any stereotype. Like everyone is very different from each other. Like even I'm Indian community, so we are very different from each other because we have different states. So get to know them. Like we don't have preconceived, ideas of she's Indian or she's from a Nigerian, so she has to be like that because I met someone from that background. We are very drastically different. Get to know the person, and I also find, to be honest, I find like people in Australia, they're a bit happy with their own circle. They are not open to getting to know other people. Like even I went to my daughter just joined in schools, and I find the moms group like a bit cliquey. Like they start forming groups. It's like if I have to make initiative to make friendship with them or make and try to engage with them. Like whereas in my culture, people like they go all the way to the ancestors. Hey, where your grandparents from, where your mom from, like all these details. But here the people are really like they're happy with their circle. They're not open to know other people. Be open to other people. Get to know their culture. Yeah, be open.
Brenda Madupa, do you have anything to add?
I think for me, Lina's just spoke my mind there.
Mm,
I think for me, mine would just be appealing to being kind and humane.
mm,
When you see a new person, many of us, for instance, myself, I'm here on my own. I don't have my kids or my husband with me. But there's a story as to why I chose to come to Australia, get away from
mm.
not get away, and leave my family behind. So I'm already struggling with certain things. Everyone that you see, every immigrant that you see has a story to tell. Just be kind.
Mm. Thank you so much. So if we don't have any more questions, we'll leave it at that. And just to follow up for the session, we will be sending out the recording and the resources we talked about. Um, and yes, being kind is free, like asking someone how their day is, and actually meaning it instead of like, how you going? And then continue walking. It really does make a difference. Um, but thank you so much for listening to us today. We do have this training package. If your organization is keen to hear a more deep version, focusing on one specific topic, we can come to you whether online or in person. And that's something that we'd love to have deeper conversations about and see what you can think of that you can apply to your gender equality action plan or core action plan that can help, at least make your workplace or your service just a bit more, no, sorry, better for women from migrant and refugee backgrounds. So, yes, so if you can fill out a survey for us, so we'll send out the recording of the core of this training session, the PDF of core alliance offerings, the 3 posters that we referred to, and a survey link, and we would love to hear from all of you. Thank you so much. And it's 11:52. We can stop recording now.